Good afternoon, everyone. Thank you for joining us for the West Virginia Collegiate Recovery Conference. I'm Carla Blankenbuehler, and I'll be your moderator for this session. We're first going to have a few housekeeping items from Susie Mullins.
Hi, everybody. Welcome or welcome back. If you are interested in a certificate of attendance or continuing education for West Virginia licensed professional counselors, or those that are certified through the West Virginia Certification Board for Addiction and Prevention Professionals, we will put the link in the chat for you to sign in. We need you to do the sign-in sheet, and then at the end of the day, be sure to evaluate each session that you attended, and then you will, through the magic of Ms. Tiffany Pittman, receive your certificate. And if you're calling in and you need follow-up information, please just send us an email and we can provide that for you.
Thank you, Susie. Our session this afternoon is Saving Lives and Creating Lifesavers, Medication Safety and Naloxone on Campus. I'm pleased to introduce our speakers for this session. Dr. Susan Bissett is the president of the newly formed West Virginia Drug Intervention Institute, a 501c3 nonprofit organization located in Charleston, West Virginia. And Mike Holmes is the peer recovery support specialist at Bluefield State College. Dr. Bissett.
Got to unmute myself. I always forget to unmute myself. I'm very excited to be here this morning. Of course, going first, there's a lot of pressure because I don't want to take up everyone else's time. But I do just want to share a project that we're working on at the West Virginia Drug Intervention Institute. A little bit of background on the Institute. We were formed in 2019. So I took this position in May of 2019 after serving for 6 years as the assistant dean of students at the University of Charleston School of Pharmacy. Originally, we were located at the School of Pharmacy at UC. We are not connected to the university, although we do have collaboration with the university. We have moved since July 1 to a downtown location on Capitol Street. Some of you will probably be familiar with the work that we've done in pre-K and elementary in regard to medication safety. And so last year we wrote a grant, and we're in conversations with the Mayor Foundation here in Charleston about supporting an initiative to get medication safety messaging and naloxone training onto college campuses. And so I want to share a little bit about that grant today. The program is modeled after Generation RX, but we have rebranded it and repackaged it as Smart RX University. So if you're familiar with our Rex, the RX avatar, we've now put glasses on him for purposes of this program to keep some consistency throughout. But I'll talk a little bit about what the goal is over the next 2 years. We have an education director who actually may be listening today, Jessica Napier-Eagle, who oversees this program as well as all of our education outreach, and have also recently hired Tanina McCourt, who's a recent graduate from Concord University, who is also studying social work at Ohio University. So she is our program coordinator specifically for Smart RX University. So to give you a little bit of background on us, there's our location on Capitol Street. We have 5 areas of focus. 4 of those 5 kind of lend themselves to being lumped together. So we have education and prevention, and then collaboration. So we do collaborate with the Office of Drug Control Policy, DHHR, West Virginia Collegiate Recovery Network, among others, and then the advocacy and research. So we're not necessarily interested in original research, but looking at literature reviews about what's evidence-based and what's effective, and then also conducting analysis on our programs for their efficacy and effectiveness. So that's the team. We're small but mighty. In front of our Capitol Street location on Naloxone Day, we were one of the distribution sites. So to tell you a little bit about the program I want to talk to you about today, like I said, we received about $150,000 over 2 years from the Mayor Foundation to support the implementation of this program. Part of our promise to the Mayor Foundation is that we would continue to administer the program after its implementation. So we're going to pick up that funding and that administration through the Institute. The funding allowed for us to hire a part-time program coordinator who will move to full-time in the second year. And I'll talk a little bit about why that is in a moment. This is what we're hoping to do. So there are 24 2- and 4-year public and private campuses in West Virginia, and we would like to reach all of those. That is within our scope of the grant. The goal is to train 20 to 30 students on each of those campuses. And originally we wrote the grant as they were going to be health profession students, but we can certainly look at other options because we know it might be campus dependent upon what available student population is there to train. But we'd like to train 20 to 30 students on campus with the goal that each of those students will then turn around and present the program to 20 to 30 students on their own. So potentially having 10,000 college students in West Virginia over the next 2 years involved and trained through this program. We have the goal of, in addition to training on medication safety, also doing naloxone training and finding ways to distribute naloxone on campus. We also want to make sure that we are distributing medication disposal bags that will dissolve up to 45 pills to college students as they want and need them. And so that might be through the residence halls for a 4-year residential campus. That might be through the counseling office. That might be through student services, could be through the bookstore, whatever each campus deems appropriate for students to be able to access that for free. That is our goal. So before COVID hit, Jessica in our office likes to refer it to BC as before COVID. But before COVID hit, we had the goal of doing regional trainings where we would bring students into a location or a campus and train them and then send them out to do their piece with their 20 or 30 students that they identify. We've had to re-engineer some things since COVID, and we're in the process of building a learning management system. All of you are in higher education, so you know what that means. It's basically going to be an online training course for the 20 students that are identified on each campus. Our goal this year is to target 5 to 7. So this is kind of our pilot year. And we are looking at the campuses that are within this region. So we're starting hopefully with the University of Charleston because pharmacy students are already engaged in this work, although I know Virginia Moore is on the call and we'd like to expand it to beyond pharmacy. And then we want to start with the West Virginia School of Osteopathic Medicine. And part of that is because there is a recovery coach that is fairly active or has been fairly active. And we also have Dream Mace as one of our board members. So she's very supportive of us starting with those 2 campuses. We'd like to try to get those 2 campuses onboarded with the train the trainer piece prior to Christmas. And the holidays. I'm sorry, I have a cat that loves Zoom, so she's going to be all over the place. She's a terrorist. She's a Zoom terrorist. So that is our hope, and then we're hoping to pick up the remaining 5 in the spring and then go full force next year and expand to all 24. So again, part of that training will be naloxone education, and we've worked very closely with Dr. Lindsay Acree from the University of Charleston School of Pharmacy. She has been working with our media partner, Murphy Media, to develop a training app for naloxone. Right now it's developed and it was beta tested. My understanding is that it's tied up in legal. That is certainly one of the things I do not miss about working on a college campus. So once we hear about that, we'll be able to use it. Otherwise, we'll do virtual training with Lindsay as part of that package. I'm sure that you all have seen some things from the U.S. Attorney General advocating for, I'm going to have to move her before she shuts us down, advocating for the use of naloxone and training folks to use naloxone in schools, not just college campuses, but K through 12. I think that college campuses at this time are probably an easier sell, so to speak, in West Virginia. Although Susie and I still have talked about our dreams of making it a reality that they're in all schools. But we definitely feel like Narcan should be as accessible as CPR, as your AED. I recently talked on Naloxone Day to a reporter from West Virginia Public Broadcasting. And, you know, my belief is that naloxone is of less harm than the aspirin that's in your cabinet. So I think it's important that we get this out as much as possible. I know I sent my own daughter back up to WVU last weekend with 2 doses, with a 2-pack of what you're looking at on the screen. So that's kind of just a brief overview. I do want to show you one more thing. So if I can get out of this and get to my website. So we have a fairly robust, oh, I want to share and it's not letting me share. Hang on. Share again. There we go. So we have a fairly robust website. If you go to westvirginiadii.org, you'll see a number of different things on our website, but at the education tab is going to be really important to this project. And there is a college students tab. There will be a secure login for people that are going to access the LMS system. But this is where you can get some general information. We also have a really brief PSA, and I'll play that to end my presentation, that is available for you to put on screens on your campus. We can even brand it with your college if you would like. This is a PSA that actually won a Gold Telly Award this past year, one of the only 2 Gold Tellys in West Virginia in the last 5 years. So we're pretty proud of the work, and it uses a lot of the tenets from Generation RX. So I'll just play this.
Research indicates that the majority of students misusing prescription stimulants as study aids earn lower grades. Here's the good news. 81% of college students do not misuse prescription medication as study aids. Staying current with class material, prioritizing tasks, and accessing tutoring and online tutorials are just some of the ways you can stay stimulant-free. And remember, never share your prescription medications. Need some advice for how to do this? Visit
So obviously I don't have as good
WVII.org.
internet at home as I as I do at work, but I wanted to share that with all of you. We can make that accessible to you in a downloadable version. We're very excited to be working with all of you. It's likely that you will receive some kind of contact from Tanina McCourt, who's our program coordinator, or Jessica Napier-Eagle, who is our education director. They'll be the main points of contact for this program. And all of I'll go ahead and put their emails in the chat for those of you that want to get a jump start on this and start talking to them about it, because we really haven't chosen who the next 5 campuses will be for the spring. So if you really want to be one of those campuses, I encourage you to reach out to Jessica and Tanina and let us know so we can get you on the list.
Thank you so much, Dr. Bissett. Any questions that anyone may have, you can put that in the chat. And we'll go ahead to Mike next, and then we'll go to the questions right after that.
Hi, everyone. My name is Mike Holmes. I'm a recovery coach at Bluefield State College, and I'm a person in long-term recovery. Since November 2nd, 1990, I have not, I've had continuous recovery since that time. I've got a screen I'd like to share with you. Okay. I originally called it virtual naloxone training during COVID, or pandemic rather, but this is just unusual times. The Collegiate Recovery Network had naloxone training pre-COVID, at Marshall University, and I had 2 scheduled when we started the lockdown. So I thought it was important to get a way that we could get naloxone out to people, and I'll show you why here in a minute. Now, this graphic here, this United States has 4.3% of the world's population. We consume 49.7% of all prescription opioids. We consume 99.7% of hydrocodone, 45% of the world's supply of hydromorphone, and 69% of the oxycodone. Does this look a little out of balance to you? It did to me. 99.7% of hydrocodone. Now, during a 10-month period, a pharmacy at Kermit got 3 million doses of hydrocodone, 10,000 a day, for a population of 392 people. That seemed a little out of balance too. One doctor in Williamson from 2002 to 2010 prescribed 335,000 prescriptions of opioid. That's not 335,000 doses. That's prescriptions, separate prescriptions. And that doctor has had no legal consequences. She's on her nudist island in the Bahamas as we speak. West Virginia leads the nation in overdose deaths. We have for a number of years. I'm just showing data from 2014 to 2018. That's the most recent CDC report. They lag about 2 years. Our number for 2018, I'm certain, is higher than this. The CDC took preliminary overdose deaths from the West Virginia Department of Health, and the final overdose death for 2018 was higher. So the actual figure is somewhat higher. I do not know if the same was over these other 4 years here. The green shows the second highest state in overdose deaths. And you'll notice we've vastly outstripped most of them. The red is the United States average. And for those 5 years, we were more than double the average overdose in the nation. And this is courtesy of the Office of Drug Control Policy dashboard. It shows the same numbers I put up just a minute ago, but it also drills down into counties. And I'm in Mercer. My catchment's Mercer, McDowell, and Wyoming counties. And we have some pretty high numbers here in these counties. So that's what led me to believe that we needed to get that naloxone out there. Here's another slide. This is also from the Office of Drug Control Policy. Naloxone given by EMS, 198 doses in Mercer County, 11 in McDowell County, and 15 in Wyoming County. Naloxone given by citizens, people that gave someone naloxone prior to the EMS arriving. 1 was given in McDowell County and none in Wyoming or Mercer County. Leads me to believe we need to get more naloxone out there. So when pandemic started, we saw the need for widespread distribution of naloxone. We collaborated with Dr. Acree at the University of Charleston to develop a method to train virtually. Chase Broyles, IT specialist with Southern Highlands Community Mental Health Center, developed online registration and survey forms. And Dr. Jamie Steins, also of Southern Highlands, he's a coordinator of community engagement and crisis service and over the QRT program here in Mercer County, offered to pay for shipping for distribution in Mercer, McDowell, and Wyoming counties through his quick response program. By the way, this program, its goal is to see everyone that has an overdose within 72 hours after the overdose and give them some options. But anyway, through this collaboration, students, nursing classes, organizations, and interested member of the public received naloxone training. Let's take a look at what kind of results we got. We trained 252 individuals virtually and distributed 175 kits distributed. Now, this number pales in comparison to what the net was talking about in the free naloxone day early in October, but still yet we're pretty proud of getting this amount out into the public, and we'll continue to do it for the foreseeable future. Thank you.
Thanks so much, Mike. Does anyone have questions for Mike or Dr. Bissett?
We do have a question in the Q&A asking if we can get a copy of Mike's slides.
Oh, certainly. Can you email me and I'll return it? Let me put my email in the chat.
This was really good information, and I'd like to share just a couple of efforts we did with the network and BridgeValley. Annette, our peer recovery services specialist, worked with some folks on Naloxone Day, and we were able to distribute over 60 Naloxone kits to the town of Montgomery. So we felt like that was a huge effort in that area, especially the area that it's located. Dr. Bissett, we look forward to working with you guys. I'm going to have Annette contact you about training some students for BridgeValley. I think we definitely have some students that can do that as well. So Annette will be in contact with you guys. Susie?
Well, I'm just really proud of the response. Back in March when COVID hit and the news, we started seeing news early with clusters of overdoses, the one in Wyoming County, and we were strategizing about what could we do because of the situation and everybody being locked down, and the group quickly took action. Dr. Lindsay Akery has just been, a tremendous, she's like the angel of naloxone in West Virginia. And, her willingness to help us get the training converted, the willingness of everybody to, pilot the training, and the partnership with the QRT with Southern Highlands and their willingness to mail the naloxone. Really eliminated a lot of barriers, and Mike's done a really great job leading that effort for what now 6-7 months. He provides naloxone training twice on Thursdays, 2 o'clock and 7 o'clock, and that join-in information is on our website at marshall.edu/CRN. So anyone can register for that and take the training, and then pick up naloxone someplace else if they are not in the 3 counties that Southern Highlands QRT serves. So I'm just really, really proud of that response and accomplishment. And that's, we have to stay flexible and we have to stay nimble in our response to various things. And that's the pleasure of being a small organization, small entity, is we can pivot like a speedboat. It doesn't take, it's not like a giant aircraft carrier that takes, 3 years to turn the thing around and go in a different direction. So I'm just really proud of that.
Susie, I'd like to also say that anyone that has an organization or group that would like trained, I'll do the training at any time, any date.
Yeah, one
I'm
of the
your
things,
choice.
One of the things that we've also been able to do during this time is to work with the call specialists at 844 Help for WV and get all of them trained, and then work with Dr. Akery to get naloxone provided for those individuals who are working the call lines and connected in the community.
Just wanted to add that I'm so thankful that this conference is happening. As somebody who has spent most of her life in student affairs on college campuses, this is just such an important topic. And I just got word, like I said, my daughter's up at WVU, and I just got word that they're probably going to do a little bit more hybrid, but mostly online for spring as well. And so this is a really timely issue too, because if you look at the overdose data on the ODPC data dashboard, you'll see that overdoses are actually going up. They're not going down. They're not plateauing. And a lot of that has to do with the isolation that we're feeling from COVID. So any unique ways that you all can find to reach the students on your campuses to keep them connected is just so key. And, years ago, we didn't have any resources for students who are struggling with addiction on college campuses. You maybe had a counseling center. Those of you like Carla who are doing counseling know that there's always more students to counsel than there are professionals to do it. So it's just really great to see the resources expanding, particularly in West Virginia. And I think we have an opportunity to really be kind of a model for the rest of the country.
Are there any other questions?
Yeah, Susie, this isn't a Mickey Mouse t-shirt I'm wearing. This is on Zoom. It looks like it's a Mickey Mouse t-shirt. You see his ears sticking up.
Mike has the most amazing array of Naloxone Narcan t-shirts. I think he needs to do a slideshow for us just of his Narcan Naloxone shirts. That was something else that we didn't mention in the other sessions, but something else that we've done during this time of challenge is started a scholarship fund drive and did a t-shirt fundraiser in September for Recovery Month. We're going to do something like that again in the spring. April 15th is National Collegiate Recovery Day, and I think we're going to plan to do another conference on that day, and have some other ideas as far as learning opportunities and sharing opportunities to continue to help people who want to get something like this started on their campus and maybe just aren't sure how to go about it. That's part of what we're here for with the West Virginia Collegiate Recovery Network, is to serve as a resource and technical assistance resource to help other schools get started.
It looks like time is about up. So I'd like to thank Dr. Bissett and Mike. Please remember to complete the sign-in sheet and the evaluation if you'd like your certificate or continuing education. We're going to take a brief break, so please come back for our next session.